So this is a story about a death at a med spa from IV therapy, which is pretty wild because, as I've told you guys, I'm opening a med spa myself.
Like IV therapy for like rehydration.
Right. Yeah.
Okay.
Yes. So that's what I think of when I think of IV therapy is like hydration, vitamins, minerals, antioxidants, that kind of thing. And so when I heard about this story, and it kind of broke a few weeks ago, and since we had recorded some shows, we actually haven't had a show since this thing kind of broke. So this event actually happened in July of this year. And the story kind of broke, I guess, because the autopsy came out, so it kind of hit the news again. So this happened just close to here. It was in Wortham, Texas, which is about 60, 70 miles from here. So
never heard of her.
So it's kind of by Mahia.
Okay.
Yeah. So this was at the Luxe, Luxe Med Spa in Wortham. And this lady who actually was a radio personality, have you heard of her, Jennifer Cleveland, Travis, being in the radio?
Jennifer Cleveland, I have not.
She was one of those stations down, like just south of Dallas, I think.
Okay.
Yeah, I can't remember. I read it, now I forgot. I should have written it down. But so she went to this med spa to get IV therapy.
Cool.
And had a sudden cardiac arrest, and that's pretty crazy because normally these therapies are extremely safe. I mean, putting IV fluids into your body could be harmful if you put like the wrong type of fluid, like say you used like just sterile water and it dropped your electrolytes or something, and that could potentially be harmful. But you'd have to give a lot of fluid for that to happen. And, in general, giving IV fluids is pretty routine. I mean, there's a ton of IV therapy places around the Metroplex and in every town. And IV therapy has gotten really big. I mean, when it first kind of came out, I was like, oh, yeah, I can understand that. Because, when people get hangovers, if you have like a hangover from drinking or just kind of feel down, you go get IV fluid bag, you feel great. Make it feel like $1 million. And so I'm not surprised that this has gotten popular. And they expect it in the next few years, by 2026, to be $11 billion annual.
Yeah, I know.
Like, that's huge revenue.
I know one person that has that as a company, and then I know two,
and
and then I know another one that works for a company that does that. Yeah.
We're gonna start doing it when we open the med spa here in a couple months. I mean, because people want it, and in general, it's safe. And so, when I heard about this story, I was like, oh, geez, what happened? Why did this girl die? Well, this story was a little bit different because in her IV bag, they had what's called TPN, which you guys probably haven't heard of that, right?
No.
Okay.
Have not.
So total parenteral nutrition. So how I know about this is when I was in general surgery, and we'd have people in the ICU from trauma or being really sick or whatever. If they couldn't eat and you couldn't use the bowel, because the first thing you do if somebody can't eat is you give them like a feeding tube. Whether it be one through the nose as temporary or permanent one through the skin, and then you actually give them like, for all intents and purposes, like Boost or some nutritious liquids to give them nutrition.
Yeah.
But sometimes patients can't use their intestines because of various maybe intra-abdominal surgeries or whatever, and so you give them what's called TPN, which has lipids, proteins, carbohydrates, and also electrolytes.
Okay.
And the electrolytes is what probably got her because, have you guys heard of potassium? I know you guys have heard of potassium, but have you heard how potassium can potentially be harmful? Is that common knowledge? I forget because I've been in medicine too long. Not knowledge. Okay.
I've heard, but I forgot.
Right. Okay. Well, when they do lethal injections, what they use to actually kill the person is potassium. Because if you give enough potassium to somebody through their IV, it'll stop your heart.
Like for prisoners?
Yeah, like for death row people.
Oh, okay. I was like, that just sounds so weird.
Wait, what did I say? Did I say something confusing?
Whenever I think of potassium.
Am I confused or are you confused?
No, I'm just confused. Whenever I think of potassium, I think of bananas. So
right.
I just think of
They're not just like giving them 100 bananas. No.
Yeah, I know. But that's
like
what you think of in your head.
No.
It's like,
so like,
all right, you're gonna die by bananas.
When they do lethal or put people to death in most states in the United States, they first give them a sedative to kind of make them fall asleep, and then they give them potassium chloride, which if you give someone enough potassium chloride through an IV, it kills you. It stops your heart. It depolarizes the heart, so the heart stops beating, and you die. And so I would guess that, well, everyone kind of guesses. I mean, it's not just me. Everyone is kind of assuming that there was a significant amount of potassium in this TPN, which is really, really odd. They would give TPN. Most of the time you give TPN, you give it over, 24 hours or something. They probably had a 24-hour bag of TPN that they slammed into her. And so suddenly the potassium in there just overloaded her heart and she died. I mean, that's,
Sheesh.
the autopsy was inconclusive, which would be the case with that. I mean, it wouldn't necessarily, it doesn't like show damage. I mean, the heart depolarizing stops.
Can you like check people's blood level of potassium or something?
Yeah, but it may have normalized. I don't know. I mean, that everyone is thinking that it was the potassium in the TPN. And it makes sense because it's like, well, what else would it be?
Yeah.
So this is kind of a bad deal. I mean, obviously, because the lady died, but I mean, there was a lot of, I guess, issues with this. It's not like, sometimes in medicine people die through things that are, I guess, not preventable.
Okay.
But this seems like it was preventable. I mean,
I wonder why that TPN is accessible to med spas.
So that's a brilliant question because it requires a prescription.
Yeah.
And so, the story goes a little bit deeper. Every med spa has a medical director. And so there was a medical director for this med spa, Dr. Michael Gallagher, who's actually an anesthesiologist, like just down the road from here. And so it came out that he was the director, and he kind of got put to the torch. The Texas Medical Board actually suspended his license pending an investigation into this.
Yeah.
Which, I mean, I think is reasonable to do because you shouldn't really be giving people TPN. And also, when you go from like giving just IV fluids to TPN, you have to have certain licensing to give that, to be the person doing it. And the girl who's the med spa owner who administered the treatment doesn't have that.
Right.
So there was a lot of like problems here where.
And then like I guess the patient that died, like did she request that type
I don't
of
know.
Supplement?
It's unsure. When I saw that she got TPN, I actually started doing a search because I was like, are there people really out there giving TPN in med spas?
Well,
Like
yeah,
that sounds crazy.
Because you said that's used for people who literally cannot eat for themselves.
Right, yeah, exactly.
Like it's because they are malnourished. And
Right.
like so a healthy woman goes in there and
Yeah,
gets,
it makes no sense. You almost wonder if it was accidentally given. I mean, I don't know. I mean, I hopefully we'll find out more information because I'm sure
wild.
this will all come out eventually. What exactly happened here. But yeah, it's pretty crazy stuff. And I went and I looked. So I did a search of a bunch of IV therapies around here because I was like, are they really doing this TPN thing? That just sounds insane. And no, they're not. I couldn't find. I didn't do a exhaustive search, but I hit like several of the IV therapy places around where my practice is and in Dallas, and I didn't see anything about
what
TPN.
if they find it's murder?
That could be it. I mean, I don't know why they would kill this poor lady.
I don't know either.
I mean,
But usually you don't know until you know.
I don't
you know,
know.
with
I
murder.
mean, I can't rule anything out. I don't know. I just
just say that because I was listening to one of those crime podcasts.
Oh, were you?
Murder
It makes me
podcasts
nervous
on
that
the
my
way
wife watches all of these like I killed my spouse shows. I'm like, if I go missing, guys, you need to like ask
every
Cindy.
time
like,
after I listen, every time after I listen to a podcast, I'm like, it's murder.
It was murder. It was murder. So, but no, I think this is just unfortunately, a preventable tragic death.
Sounds like it. Sounds like a
because
horrible mistake.
I think some bad things happened here, and like I said, I don't know for sure, but at least from the reporting in the news, that there are some things that shouldn't have happened. So
I wonder if there's ever been any like other red flags at that particular.
that's a great
med spa.
question. I didn't notice that. I didn't see that when I was looking through it.
Well, now it has a
And I guess the
severe
thing to
red
learn,
flag.
whenever we talk about these things, obviously we want a potential audience to learn something from it, right? Well, I mean, when you're getting when things through an IV, whether they be fluids or drugs or whatever, your margin of error is a lot lower, because it's like a main line, right? And so
Right.
it's like you have to be aware of what you're getting. And because of this, I think people should at least be alert if they are going to do IV therapy. What is in this? Is there anything that's potentially harmful if given through the IV? Because if you ask that question about TPN, if you said to me, "Hey, is there anything in TPN that can harm you if you get too much?" Like, yeah, the potassium can kill you. And so I think that's something that potential patients should just be aware of. And also, too, is the person licensed to do this?
Yeah.
Med spas are a little bit of the Wild West. I mean, there's some stuff that happens in certain med spas that's kind of, questionable. Fortunately, most of them don't necessarily result in things like death.
Yeah.
You know, but in this case, it did. So it's an interesting story. Have you guys ever got IV therapy?
I have.
Have you?
I think.
Yeah. I meant not like in the hospital when you're having surgery or something.
No.
Like as an outpatient? No.
I think I have.
Have you? You don't?
Not myself personally, but I've produced a show here, right where Sarah is sitting actually. And there was a guy who did IV therapy while he was doing the show.
Oh yeah.
Yeah.
You could totally do that.
They hooked it up and did it while they was doing the show.
It was so funny. We went on a little weekend vacation with some friends of ours who were doctors, and it was to like a music festival, my wife and I. And when we got there, they had brought like bags of IV fluids, like in case, you know, they'd drink too much so they could give themselves IVs. I was like, man, that's hardcore. I've never thought to do that, you know, personally. I was like, you guys are all in.
That's wild.
So, all right, moving on. Cool story. Let us know what you think about IV therapy. Do you like it? Do you not? Have you had it? Let us know in a comment. We'd love to hear from you. So.